Welcome to Lovesick, the podcast where we dive into health, wellness, and relationships and their impact on the world today. Come be a part of the discussion and join our community by following us on YouTube, Instagram, and listening wherever you get your favorite podcasts. Enjoy the show.
Hey, welcome back to the Lovesick podcast. I'm Michael Fishman, and I'm here with Jada Ford. And Dot has the day off. No problem. She's just out enjoying some of the other parts of life. So today, we're holding down the fort together. And we have a very special group of people in the studio today from Simple Health in Long Beach. We have Julia Wu and Michael Adams, who are both here to talk about holistic medicine and acupuncture and the world of stress and fertility and kind of holistic medicine. Right?
Absolutely, yes.
Welcome.
Yeah. We're happy to have you.
Thank you for having us.
Yeah, I'm so excited. Maybe tell us a little bit about your facility and kind of some of the stuff you guys do and share with our audience.
Sure. So I have been in practice since 2009. Always sounds like it's been a long time. And I started the clinic actually in 2011. So it's been around a while, and it's grown from I was renting a room out of a podiatrist's office when I first started to now we have a facility with I think we have 10, 12 treatment rooms. We have a team of 3 acupuncturists, including myself and Michael. And we have a chiropractor and a bunch of massage therapists.
So we've been trying to bring to our audience more information about holistic medicine. I think people don't fully, especially in the Western culture, they don't fully have a grasp of it. So I have lots of questions. But before we kind of get into the specifics of acupuncture in particular, for each of you, what kind of drew you to this area of work? What kind of drew you to this expertise?
Mike, you want to?
Oh, sure. Well, I guess I always had an interest in medicine and in science and all those different aspects that come with it. But I didn't really have a very strong pull to become like a Western doctor or nurse or something within that realm. But my dad had a friend that was an acupuncturist, and it was growing up in Delaware. It was kind of a very foreign type of medicine there. Even though it still is now today, but there something totally new. And I was just super curious, and the more I learned about it, the more I wanted to really dive in and become an acupuncturist. So here I am.
Yeah, it's funny because his dad is a medical doctor too.
Well, and I think that's part of the beauty is one is not anti the other, right? They're not in opposition of each other.
It's not supposed to be.
Right.
I would say that there are a lot of doctors who are very open-minded. We have patients that are doctors that come in for acupuncture, chiropractic, and they often are the ones who are referring, who talk to their patients about how great holistic medicine is. But we do have patients who also tell us, "Oh, my doctor said absolutely not. That it's just a sham. It doesn't work." I think it's just from lack of communication and lack of understanding because they don't really teach in Western medicine too much about how does acupuncture work, and I think it's hard to explain because it's also hard to study
Right.
in a scientific way.
Can you actually, for the audiences who may not be familiar with acupuncture or may have a small idea of what it is, can you tell us what it is and what most people tend to use it for?
Yeah, so acupuncture is traditional Chinese medicine. Well, I should say traditional Asian medicine because it's used in many different Asian countries. And it's been around for several thousand years. The exact length of time is very highly debated, but we know it's at least 2,000 years of, I think, written history. So it involves the insertion of very fine, what we call filiform needles versus hypodermic needles when you get an injection or a blood draw into different parts of the body that we call acupoints. And these acupoints can be all over the place, but they generally follow patterns, pathways that are called channels or meridians that are related to your internal organs. So we are we going into like specifics about
Go for it. I want to hear.
yeah, um, anything you want to add?
Um, yeah, so I guess those pathways that Julie was talking about, they can influence the different organs. They can also just influence the whole body's composition as a whole. And I guess that Chinese medicine can be extremely complex, but it can be very simple too. And that like the simplest aspect of it is that, you know, there's the yin and yang qualities of your body,
Right.
and they become out of whack due to, it could be stress, it could be disease, it could just be a cold, it could be lifestyle or whatever. S-
Energy. I mean, I know people sometimes look at you a little funny when you start talking about energy work
mhm.
or alternatives, but like we are energy beings. I mean, we're now getting to the point where science has kind of validated that aspect, and there is an energetic and an electrical flow that's flowing through your body, and that's one of the things
Absolutely.
for acupuncture, like to tie into the meridians, to tie in and help release either. Think of it more like no different than the flow of blood through the body. I think the best way is to think of energy and health, and all of these things are your systems are flowing in multiple levels, whether it be your lymphatic system, your circulatory system, your energetic system, and the kind of transition there. I think for people. Um,
Yeah, we are essentially giant bags of salt water that are being conducted and moved by pulses of electricity within our own bodies. That's how neurons work. That's how your brain works. That's how we power life. So it's funny because you say that there's no difference between blood flow and energy. I agree. We often talk about because acupuncture, Chinese medicine in general, is always like what Mike was saying, trying to bring your system back into homeostasis.
mhm.
If you are in balance, there should be no pain, no disease. But if something is out of balance, which happens very easily, then our goal is to figure out based on our observations, based on what the patient is telling us, and try to bring the different organ systems back into harmony. So, we talk about chi and blood a lot, and chi is often translated to energy. Um, and I always tell my patients this because I think it's funny. Um, when you talk about like the uh, kind of woo woo stuff,
Yeah.
so which I don't necessarily like. I It's not that I don't believe it, but it's that I think people have a harder time relating to when you're trying to do energy work on someone. Even if I can feel it, I can't explain it.
Yeah.
But the word qi itself in Chinese doesn't translate to energy. So I'm Chinese. I speak Mandarin. It translates to air.
Mhm.
So what is inside of air that is really important for our bodies? It's oxygen, right? So oxygen, and I don't know if you guys remember your high school biology. But oxygen, essentially, the reason that we need it is because it gets converted into uh, ATP, which is the fundamental units of energy that powers our cellular functions within the body. So, yeah, essentially, air is energy.
Yeah, and
Yeah.
that flow, that transition through your lungs. But people at home, if you're somebody who believes, awesome. You're probably saying right on. It's about time, right? Because I think people who have acupuncture regularly are like, I've been telling, right? But for people kind of in Western culture who may be hesitant, there's probably somebody at home going, needles, I'm out, right? But it's also the difference, right? I volunteer in a hospital, and the perception of needles is big, or drawing blood or things like that. And most people only see them when they're sick. But these are really tiny, very specific. So while it's a needle, it's more of almost like a pressure point indicator, right? They're not needles in the way that most people think of, like hypodermic or like injection needles.
No, so I think I always ask my uh, patients who ask me about what the needles are like, especially if they work in the healthcare field, like if they're nurses, I'm like, what's the biggest gauge that you guys use? And usually they'll tell me like a diabetic needle is like a 30, 32, something
Mm.
like that. And the bigger the number, the smaller the gauge. So the biggest needle that we use is what,
Oh, geez.
like a 36. So
Probably, yeah.
so it can fit pretty comfortably inside the hollow of a regular hypodermic needle.
Right.
Oh, wow.
So
So you're talking
it's
about the inside of the inside of
Inside
the
of a
yes,
inside
hypodermic
of
needle.
the needle that people normally, if you haven't
yeah.
experienced it before, so don't get so
Yeah.
come with an open mind. I think this is one of the things. Maybe talk about all the different things that you can treat. I mean, because I know stress and imbalances and health and there's almost it's a much more almost
But
what you
then,
what
but
you
then to
can.
piggyback, do people also come just regularly just to keep themselves balanced
Uh,
moving
yeah,
forward? Yeah.
absolutely. I always tell patients that when they ask, "What is it good for? What can you do?" Um, Being a traditional medicine system before the advent of modern medicine and pharmaceuticals, this is what people did. You get sick, you go get needled, you get acupuncture, you get herbal medicine, which is actually a huge part of Chinese medicine as well. Um, so the scope of what we can treat is everything. But if you have a fractured bone, please don't come to us. Please go
No, but
to
that's
the
good to
ER.
know. 'Cause
Well, some people might not know. I think
yeah.
that's part of it. I mean,
Yeah.
historically speaking, warriors did this between battles, right? The farmers did this to keep themselves healthy. They did it with children, right? To help the
Yeah.
flow and
Yeah.
energy and growth.
Again, it's not Chinese medicine in China a long time. It was just medicine.
Right.
Yeah.
So I think there are certain things that I personally feel like acupuncture and holistic medicine in general, like we're a little bit better at treating, at addressing than modern Western medicine has yet to find a solution for.
Yeah.
Can you give us some of those? Because like I want people to hear.
Yeah,
Oh.
yeah,
Um, well, I guess, for instance, headaches, we're pretty awesome at treating headaches, the common cold, um, just stress, menopause, fertility, all those things. And then just preventative health in itself. I mean, I don't think Western medicine addresses just preventing the body from becoming sick. It's more of a after the fact
Yeah,
kind of
reactionary.
application.
Yeah.
And those people that are constantly coming for acupuncture or whatever type of modality that they're choosing, they are strengthening their body, improving their immunity. If you're keeping your autonomic nervous system more centered and not so in that fight or flight all the time, your body's not releasing so much like cortisol and other things that are causing inflammation and other problems. So, this is a big part of it.
yeah. So have you guys heard of the HPA axis?
I have not.
Have
Have you?
I have bits and pieces. But
bits and
Okay.
please,
pieces?
yeah.
Okay.
But
Um,
explain it for us,
Yes,
please.
please.
So when your body, well, the HPA axis first of all stands for the hypothalamus, pituitary, and adrenal cortex, or adrenal cortical axis, which is three important organs within your brain, and the adrenal is right on top of your kidneys. Um, they are responsible for a lot of the hormonal regulation in the body. So, namely, like when it relates to stress, the pituitary releases something called ACTH, which is adrenal corticotropic hormone that ends up telling your adrenal cortex to make cortisol. Now, you guys have probably heard of the term cortisol, right?
Right.
So, when your body encounters a stress factor, something that causes your stress to spike, it will trigger the pituitary to release the ACTH, which then tells your adrenal cortex to make cortisol. But then the cortisol is supposed to have a negative regulation back to your pituitary, say, okay, now that your fight or flight is up, it's supposed to go down. So, what happens when you're always under stress?
in our
So
modern
Yeah.
world, right? Like
That's our
and I
modern
think
world right
in
now.
a lot of
right,
ways we're stuck. I mean, we've talked about this in other episodes. It's like when you get stuck in that mode, when it's the combination of everything.
right. So your body never actually comes down from the downregulation signal. And, there are many different clinical trials that have been done that study the effect of acupuncture on stress, on which stress, chronic stress can cause and lead to like anxiety and depression and a bunch of other, physical factors. But um, acupuncture can affect and regulate the HPA axis. So it allows your body to break that negative cycle where it's no longer regulating itself. So,
and
Very
and
interesting.
irregularly regulating it, right? Like essentially leaving the stress on, right?
yes,
Like the in our modern world, there's all this data now that our stress level basically gets turned on. Our body goes into fight or flight, and it's taking longer. And some people are having a real difficulty ever turning it off. And that, I mean, it's something that we're finding more studies on now. But stress is literally, it's kind of the silent
it
killer.
is the
It is the
silent. It's
silent
not blood
killer.
pressure. It's stress.
Yeah, and it's working against every organ. It's working against your mind, your every portion of your system, and the
Mm,
electrical flow is combined with that.
yeah. I think so many people, like you were saying, people who aren't familiar with this and who are turned off by needles. Um, I do want to say one thing is that most of our patients, they end up falling asleep on the table.
Mm.
Right?
That
Mhm.
sounds lovely.
Yeah.
Right?
That
Lovely and
sounds
relaxed, right?
relaxing
Like
and
Ninety
helping your
percent of the
body.
time.
yeah,
Yeah,
and you guys, I mean, there's massage there. You have holistic
we
medicine,
do.
so
Mhm.
it's a kind of a holistic and whole body experience that you guys have
Yeah,
provided.
Mhm.
it's sort of integrative, holistic medicine.
Awesome.
And obviously, to become an acupuncturist, we are educated a lot in Western
Right.
medicine and
I
science.
imagine a lot of people come for complimentary though too as well. Yeah.
Yeah, yeah,
Yeah.
like a lot of cancer patients.
Oh.
Mhm.
We actually treat for alleviating the side effects from their chemotherapy,
Mhm.
radiation treatments, just sort of helping them feel more comfortable through the experience from like the low energy, the nausea, the fatigue, the pain.
Yeah.
Do you,
One
oh,
interest, oh,
go ahead.
one interesting thing that Michael brought up was about fertility. Because I'm very curious, unless you were going on the
No,
lines of that.
100%.
Okay.
That's exactly where I was going because we kind of had this talk before.
Yeah, we had this talk before we were filming, and I was very curious to know just what your process is for someone going through fertility issues, but also I've learned about a whole male side of fertility issues that I had no idea existed. So, can you guys talk us through this?
Yeah,
Because it's very
maybe you
interesting.
could
Yeah,
start us
Yeah,
sure.
from fertility in general, and then Michael take over with the male side because I think it's super important for people to hear.
Yes, absolutely. Yeah, yeah. Dr. Mike has a little more experience with the male factor aspect of things. But I personally specialize in fertility and women's health. Um, I started studying it and trying to understand it better from more of a personal journey. And I think that's how a lot of experts start things, right? So, my husband and I struggled to conceive, and I have a condition that is called PCOS.
Mm.
Uh, so, that is a very difficult condition because your body does not menstruate regularly. It does not often ovulate on its own. So I tried acupuncture and a lot of herbal medicine. I tried everything for PCOS, and it was sort of successful for me in terms of improving, like the regularity of my cycles and whatnot. But ultimately, I ended up having to go through some rounds of IUI, which is intrauterine insemination, and ultimately, when that didn't work, an IVF round. So I have a lot of personal experience, and even before that, just working with many different patients. And acupuncture can help you through the entire process. So there are patients, and I would say if the patient is for women, if the patient is younger than um, probably 40. So under 40, and you want to try to conceive naturally, I'd say, yeah, give it at least 6 months to a year using acupuncture and herbal medicine and dietary lifestyle changes where we can try to regulate your body so that we can time your cycles so you can try naturally.
Mhm.
But it does take time because often we're gauging the success of these treatments by how regular your menstrual cycle becomes, because it all comes down to that, really. Like in every cycle, every ovulation, there's only like 24 hours where you're actually fertile, so it that's why it takes time to see these results. But every bit helps and every bit counts. But if you're over 40, um, the ovarian reserve and the egg quality is just kind of not as great
Mhm.
at that age. And I would strongly, suggest that you do acupuncture, but also seek the help of, reproductive endocrinologist, which is a
Mhm.
fertility doctor.
Yeah, it's so fascinating. I'm just one of those people. I believe that we take for granted the difficulty of what it really is. Like we have this assumption in society, it just happens that reproduction is easy, or that that the mortality rate is lower than it is. And I was super lucky. I have two biological children who their mom technically probably wasn't supposed to be able, but we were so young we didn't know.
Mhm.
But it meant that we couldn't have more. And I've known
I'm also
countless
thinking of the
families, and
societal pressure too.
yeah, the societal
Yeah.
pressure that comes on, and the particularly for women, I think there's a lot of pressure, and the assumption is, oh, this should be easy, but there's so much more to it, and I don't think we give people the compassion that they deserve. And listening to you talk about your journey, and part of it is optimizing your body in preparation for this,
Yes.
which
That's
I
Exactly.
what it
don't think
is.
we do. And
That's
I
exactly what
don't
it is.
I you never hear most of particularly Western medicine. You don't hear about optimizing your body in preparation to have a child. It's like, oh, we're just going to do it now, or
Mhm.
and plus you've interfered with it for a long time. A lot of times,
Yeah.
first you optimized yourself not to have one
Yeah.
through all the hormones and other things and other choices. Now you're trying to optimize in order to be able to, and I think it's complex.
Yeah, I really like that word, optimizing the body in preparation, right? Um, this is my typical for infertility case that I see is a woman who's in her mid to late 30s and who has been on birth control um, for many years. Sometimes these women are on it for like 15, 20 years. So
Yep.
imagine how young they were when they started,
Right.
and they're just dishing these contraceptive hormonal pills out like candy. And yes, I understand the importance of, like contraception, especially for teenagers, but I don't think that they're being fully educated on the long term effects that it can have.
And the impacts, the alteration of your body, the
Yes,
alteration of your cycle, alteration of
of
the
your
chemistry,
Hormones,
of your
mood,
hormones.
mood,
Yeah.
chemistry.
of your
Yes. As a
personality.
person who's been on it, yes.
Yeah.
Yeah. And,
Back in the day.
obviously I'm not the best to speak of that. So good. But I think we rarely have these conversations.
Yeah, I've had patients tell me when they got off of hormonal birth control finally after like a decade or more that they find that they don't know themselves. Like they're
Mm.
trying to explore
It's
who they
it's
are.
interesting because I remember, I mean, obviously for obvious reasons, but I also had irregular cycles when I was younger. And so a lot of the times I went on it early because just to regulate it. But then there was a time like by the time I got a certain age, I was like, I don't even want to be on like this anymore because it's just like I felt like what it was doing to me was just not, was
Well,
not
I've
helping.
heard data in recent years where they're talking that it literally alters who you might be attracted to or
Yeah.
what your
Mhm.
interests are. Like,
Yeah.
so
Yeah.
when we start seeing rising divorce rates, when we start seeing an increase in kind of the conflict and the amount of mental health issues that we're having, especially among young people in general, I can't help but wonder, is this a contributing factor, right? I'm not blaming any one thing, but I would say if you're changing your hormones, that's going to change how you feel, how you react, and what you're both attracted
Absolutely.
to and
Mm.
how you feel about certain
And think about
things.
the come
Mhm.
down off of it too, because
I,
it
well,
doesn't just
I can only imagine because
you
obviously,
don't just go off and then you're like, I'm back to normal. It's like, no,
well, I
my
mean,
body's supposed to get what is normal.
right.
Yeah.
Well, your body might. That's the other part. Going back to what you said is, if you started when you're 15 or 20 and you're in your mid to late
Your
30s,
body's already changing.
basically you went through an entire large, what that used to be almost your entire life
Yeah.
cycle with these hormones. Your body might not know what normal is
Yep.
because it started early or before it had time to fully regulate itself.
Yeah. And when you're younger, you don't think about some of these consequences. I remember doing this. I was on birth control for just a few years. And I remember, hey, I'm going on vacation next week. I think I'm just going to skip my period.
Yeah,
But,
but that's the logic. Like, I don't want my period, so
yeah.
I'll make sure I take this.
Yeah.
What?
So,
That's foreign to me. Now in this thing though, since we started down this road, I do actually want to ask, because Michael talked about male fertility, which so rarely is discussed. And I also think socially, a lot of times when there's infertility issues, almost inherently we blame the
The women.
female,
Yep.
but there's so much more to it. Michael, maybe take us through the male fertility side.
Yeah, sure. So like I think the numbers are 15% of all reproductive age couples unfortunately have to deal with some kind of infertility challenges, and 50% of that is male. Whether we want to admit it or not, that's what the statistics.
Hold on,
Oh,
hold on,
I know.
hold on.
Can you say that again?
Right. Well, no, because I think
For the people in the back.
I'm going to say this as a guy, because I can tell you I don't know a whole lot about being on hormone therapy from birth control, but I can tell you I've known people who were trying to have kids, and I've known people who ended up in different scenarios, and it turned out that the problem was from the male side. And I was often friends or worked with the women who had blamed themselves for years.
Mhm.
And
Yeah,
so to say,
that's what we do. That's our natural
yes,
thing.
but
Because
that's
it's
a
like,
societal thing.
yeah, no, I know.
And so, Michael, give us those stats kind of one more time, like the rough numbers.
Yeah, so the rough numbers are about 15% of reproductive age couples have some type of or infertility challenges. And then about 50% of them are statistically showing that it's male.
And it
So, I
makes
mean,
sense.
yeah.
There has to be at least 10% of the male population that is
Mhm.
contributing to some of the infertility issues, right? And I'm going to guess that number is a lot higher than that, but that's minimalist.
I mean, I think it's going to continue to rise because,
Yeah.
Guys don't carry purses. And
It's
where
true.
do you store your cell phone?
Yeah,
yep.
yeah, that's a great point. I mean, all of the environmental factors.
Sure.
So,
Yeah.
so
Like,
tell us how you kind of work in that area, and what are the things that you kind of specialize in?
yeah. So of that 50%, which are the males, about like I've seen different numbers for it, but like 30 to 50% are what fall into the category of idiopathic. And what that means is like they're not able to find a cause. So there's like some sort of issue with maybe like sperm count or motility or morphology or something like that. But there isn't like a diagnosable reason as to why that's happening. So I mean, that could be lifestyle issues. That could be sedentary lifestyle. That could be they're drinking too much, or diet's wrong. There's smoking going on, or other drug use, or who knows what it could be. Endocrine disruptors are kind of like what Julia was talking about a little bit there with microplastics and things in our foods now, and we kind of really have to look at that differently. But those are all things that can impact a man's fertility, and we would typically talk about what their lifestyle is like, and then go into a Chinese medicine diagnosis and apply acupuncture, herbs, and figure out a treatment plan from there.
I wonder how many men are in denial about that stuff, though, because
Well, you're right.
Yeah.
I think,
Mhm.
but I think it's a combination. I think not just the denial. That's a great point. But I also think not just the denial, but also because men don't talk about their health very often. I think just ignorance, right?
Exactly,
Like some are probably in denial, but a larger percentage probably are just ignorant.
ignorance, yeah, for sure.
I want to say that, in 13 plus years of practice, I can count on one hand the number of times that it was the guy who brought his partner in
Mm,
for a fertility evaluation versus the other way around.
right.
Yeah, of
Oh, I
course.
can only
Oh, I
imagine.
can only,
Hey,
only,
I
only.
can only imagine. But
It's a mental toll that it takes on women. I just want to say, mental toll.
no, but what I would also say is, I'll say it from the male side. If you love your partner, this is also a great way to take some of the stress off them and take some of the stigma and blame. Is be open to the fact that this is a journey for both of you. Because if it's gonna work, that's the other part. You're trying to make a baby.
Yeah.
So you're this is a partnership thing. It takes two people for a reason, right? Like, I'm a firm believer. It's one of the reasons why you need as many loving people in a kid's life as possible. But this is kind of before you have the child, part of this is love each other enough to not point the finger, but to build kind of a bridge to what your goal is. And
Yeah.
I think it's a really beautiful thing but it's important that men hear acupuncture is really good for a lot of men, especially a lot of athletes, especially as they're starting to have actually as they age, as their body starts to change and they're starting to have more pain and their testosterone starts to decrease. Acupuncture is actually one of those things that has been shown to help uplift them and slow that process down. And I think it's so important.
Well, just to clarify, we can't give you more testosterone.
No, I didn't say you were giving anybody, but you can
Good.
help optimize the body, right?
But yeah, all joking aside, I don't think that we can really use acupuncture to increase any specific hormone, but
Right.
rather to sort of bring down the difference. Like for we talked about yin and yang, and I always give an example where you start off where there's a relative balance of yin and yang, and yin is the female element.
Mhm.
And it's related to nighttime. It is water instead of fire. It's cold instead of heat. And yang is everything else, right? So if yin is your estrogen, yang is your testosterone, right? So as we age, for females, the estrogen goes down, so your yin decreases. So menopause, the most common Chinese medicine diagnosis that we have is kidney and liver yin deficiency. So yin deficiency, you don't have more testosterone, so you have a relative excess, but that relative excess is enough to make you start to grow hair in places you shouldn't have them, start to give you like the hot symptoms, like the hot flashes, the night sweating, the irritability, the insomnia, um, a lot of these yang type symptoms. And it's works the opposite way for men. So we're just trying to bring this relative unevenness
Bring
back
the
into
balance.
balance.
Yeah.
So to ease the transition.
Yeah, and I think traditional Chinese Eastern medicine is all about balance. It's all about kind of keeping things. You use the word homeostasis, which I think is a great word that we use in Western medicine a lot too.
Yes.
And I think that's the thing. They're not competing with each other. These should be things
They're
that
not competing against each other.
well, they
These
shouldn't
people-
be.
and of course they
In
shouldn't
a
be.
healthy lifestyle, no, we should be open to all of
Yeah,
these
of
things, and we
course.
should be maximizing ourselves. And I think one of the things that happens is it's also something that men do predominantly. I'm a blame. I'll fall on the sword, and men can send me the notes and the letters. But we have this idea that masculine is men and feminine is women, and that this idea that the truth is you have masculine traits and feminine traits and more feminine hormones per se in men the same as you do in women, because we start from the same
Mhm.
we have the same biological makeup. It gets split as you get defined based on your chromosomes and all that stuff. But from an energetic standpoint, just like there's male and female quote unquote traits, but it's really masculine and feminine, and like there's no reason men can't be nurturing. Like you should be,
Yeah.
right? Like there's elements of this in us.
Yeah, the Tai Chi symbol is a perfect representation where, the black and the white,
Mhm.
and there is a white dot inside of the black half, and
Yes.
vice versa, right? So there is a little bit of yin in every yang, and vice versa. So
Now, actually, I want to ask about the herbal side of this for a moment.
sure.
What are the herbs that people, especially Western people who have never really explored this part, what are some of the herbs that you think people should be normally taking or interacting with that most people are not?
For what condition do you think?
Well, maybe for general health, I would say, or and then maybe specific to a couple conditions.
So, um, I guess herbal medicine in Chinese medicine is different than how we view supplementation and vitamins
Right.
in modern society. I guess it's much more fine tuned for what you're presenting, like right now. So if you have a cold, we're going to give you something that fits you in that presentation right now, as opposed to you're going to take this supplement all the time, and then
Right.
you end up taking 30 things every single day for who knows how long.
Forever, or people just adopt. I think that's one of the places where
Yeah.
we burn out our body, right?
Yeah, which could cause some other issues down the line. But the way that the formulas work is, they're kind of like you're a puzzle piece of whatever your presentation is now. We're adding that other puzzle piece to kind of bring you back to a balanced whole, and then you can move forward, from there.
Yeah, Chinese herbal medicine is so complex. I think if you asked any Chinese medicine practitioner, you never stop learning because the true herbal masters continually learning from their clinical practice. And like what Mike was saying, from one day to the next, say you have a cold, you may not be using the same formula because your presentation is different. And there's also a saying in Chinese, it's 是药三分毒. It means if it's medicine, no matter what it is, there is 30% of it is toxic.
Mm.
So
Yep.
so
Y-
there's
Which is a healthy
nothing,
outlet.
yeah,
Yeah.
there's nothing that I would say Chinese medicine wise that you need to be taking every single day.
Right. Right.
So that's why when you asked, I said, what condition?
Right. Well, and I guess I
Yeah.
think like also people I think don't understand from example, and I probably worded that question wrong, which revealed a little bit of ignorance on my part, which I think you got to own, right? And what I would say is like for example, whether it be a cold, right? If it's presenting in your head, nose, and throat, that's way different than if you're experiencing it, say, in your stomach or in a renal area, right?
Mhm.
Like, so that would be a very different kind of thing, and it may shift, right? Like, you may start stuffed in one area, that drainage may
Yes.
occur, then you may shift to a different area,
Yes.
right? So, for people who are listening to understand, that's one of the ways, I guess, to better assess the way the way I kind of messed it up to begin with, but so people understand, right? Like that's how it can shift. Is
Mhm.
maybe it, you come with a ear infection, for
Mhm.
example. Well, that may transition as you start to release and move some of that stuff, and the body is processing that waste.
And that, you know, don't sell yourself short. I mean, like, I don't think you messed it up at all. I think it's just that it's hard to understand Chinese medicine, even for Chinese medicine practitioners. Like a ton of acupuncturists do not practice herbal medicine.
Mhm.
Yeah, because it's hard, and you don't want to give people the wrong thing. Um, I feel like that if you're asking about, are there some specific things that could be good, for, like, generalized everyday use, kind of like a supplement, I would say there's a lot more that you can use through the diet.
Right.
So, for example, like, have you guys heard of the goji berry?
Mhm.
Yep.
Yeah, so it's become really popular. It's, like, marketed as a superfood, a lot of antioxidants, and yeah, it does have all those things. But in Chinese medicine, it's actually used as a Qi blood tonic
Okay.
that is really good for the kidney and the liver, and it brightens your eyes. But it does have a lot of sugar, so
Wow.
so,
So, for example, if you were diabetic or if you had a sugar
so
issue,
yeah, you would have to. You wouldn't take it every single day,
right?
right? But you could use small amounts of it in the food on a regular basis. You can make teas with it. You can take it as powder. I love putting it into chicken soup or bone broth. Yeah, it's really good. There are many other food as medicine aspects. That's part of traditional Chinese herbal medicine. Yeah.
Now, for both of you, I'm curious, not because we can't talk about people's specific cases, but are there certain cases for you that you're like, this is why I got into this? Do you have kind of an overall where you're like, I love what I do and this is why I do it? Because I know both of you had a journey to this point.
Yeah, I think I actually skipped that question in the beginning of why I got into acupuncture. It's sort of similar story to Mike's. I um, studied biology, and I thought I wanted to become a doctor, and it wasn't actually um, anything like any of my existing patients after I had started practicing. But before I got into acupuncture, I was doing a lot of volunteer work at the hospitals and, trying to, build your resume to get into med school. And I was working for this cardiology place. And uh, I, there was this old man who he was on 8 or 10 different medications.
Mm.
And at the time I was in school and like I didn't know what all those medicines meant. And I had to translate for him because he was a Chinese speaker. And so I had to look all of those things up. And as I looked it up, I realized, oh my gosh, there's like not just, 1 or 2 different medicines that he was taking for high blood pressure and cholesterol. He was taking like 5 or 6 different ones, and a lot of them were pretty high doses, and he was feeling, very ill, and some of them were prescribed by the cardiologist, some of them were prescribed by his primary, and they were not communicating,
Mm.
Ooh,
and
that's the bad part right there. Yeah.
yeah, and because of the, language barrier as well, I don't think he was getting the help that he needed, and they kept on prescribing him, increasing doses of water pills to, um, counteract the side effects from all of the other blood pressure medications, and it was making everything worse, basically. So I got together with I finally, brought it up, to the patient's family, and they finally communicated with the doctor and they were like, you aren't supposed to be on this many things. And that's just one case,
Right.
and it really sort of opened my eyes as to like number one, what is the point? So as a Western medicine doctor, I would be trained to prescribe pharmaceuticals to my patients
Right.
in everyday practice, right? And if there's no communication going on, if your FaceTime with the patient is 5 to 7 minutes, for a lot of these chronic, really serious health conditions, I don't want to do that. So I started looking for alternatives, and I'm Chinese. I don't have anybody in my family who's a Chinese medicine doctor, but I thought I would explore it, and it's something that I just didn't look back. The more you learn about it, the more sense it made to me.
We've had
I
a lot of conversations like that on our show about just having an illness or being prescribed lots of medicine
a
and
lot of our guests have that story.
yeah, have that story where it's like, I'm taking this for that, but this doesn't help with this, and this is for this. And then it's like, but is this really treating the other? And it's like, it's then we start getting pumped full of medicine.
Well, and then you're chasing the symptom spiral, right?
Yeah.
And you're trying to figure out which one is causing which. One of the things I really loved about doing research on you was, you were at Berkeley. You were at one of the best, right? So I think sometimes when we talk about what Western culture will call alternative medicine, right?
Yeah.
Which it's really not alternative. It's just it's a it's a different type of medicine, right? This medicine's been around, like you said, forever, essentially in human history. And you came from a very Western medicine kind of
I did.
starting place at a very elite level, and I want people to hear that because I think sometimes people that's their way of trying to like dismiss or that can be the inherent bias, I think, from what Western culture comes from. And I think it's great for people to hear, particularly from you. Like, you came from this background. You weren't anti this. It's not like you came to this part of medicine because you were force. You
No,
found something amazing.
I want to make it clear that I'm not against like pharmaceuticals as a whole. I just think that it can be better managed, and I often go over med lists with my existing patients. I'm not giving them any specific advice about how to take their medicine, but I want to know what they're taking and if I can figure out if anything might be causing their current symptoms. And then I tell them, you have to talk to your doctor about this. So that's, I do think that there are some very important life saving pharmaceuticals,
Oh,
but
they're important.
they're very important. But I do think that, yeah, largely there's a lack of communication.
Well, and it's a
And
Which
rush.
is huge.
Our medical system's in a
yes.
rush, and
And
we're not always holistic.
no, and also I think not to bring like big pharma too much into this, but there are specific drugs that are definitely being pushed more by doctors because of, you know, political reasons,
Yep.
and things that they don't really they doctors don't even understand because like, and who is telling these doctors? It's pharmaceutical reps, and a lot of them don't even have a college education, and they're being, you know, they're teaching the doctors how to use these drugs. So that's what scares me. Is
Mm.
that yeah?
Yeah, and I'm a firm believer too. Is when we're treating stuff, the goal ideally would be a decrease in medication over time. But realistically, especially with most pharmaceuticals, they only go the opposite way.
Sick care.
It is a
We said
it is
sick
a
care.
continual escalation, right? The dosages almost always go up. And one part that I think we don't talk about enough is, I mean, you mentioned dietary. A lot of stuff can be managed or altered through what you're taking into the system as a whole, right? We are one big chemistry set. And so sometimes people take pharmaceuticals as in lieu of making life changes. That part of those life changes are what brought
Do
you
your
here.
diet.
all the
Yep.
time.
I mean, your mom,
Lifestyle.
Dot, talks all the time about how her life changes literally have brought her to the place, of dealing with her sarcoidosis
Yeah.
and her health that it is now. And if she was here, I can guarantee you, I can almost hear her saying,
Talking about it.
it's about, yeah, like, she would say, I'm living proof sitting here that,
Yeah.
you have to change your diet, that you have to alter the way you go about it because it's all of it. And she made her health concern in some ways, she always says, like, she made it her strength.
Yeah.
She made it her journey. She didn't pick this. She always says, I didn't pick this battle or I didn't pick this journey,
Mhm.
but now I'm here to make the best of it.
Yeah, dietary changes are very important, but I don't think there's any specific one that works for every single person. So you
Sure.
have to make sure. So, there's a lot of fads and trends out there in the nutritional dietary world, like, gluten free and keto and a bunch of these things. So,
We've had a lot of discussions about these.
yeah, yeah. I always try and tell my patients, I think, you need to, the easiest way I think is to keep a food journal.
Mm.
Um, and you have to do it for at least 30 days. And then also log what symptoms you might be having during that time. And then start an elimination diet. That's probably the easiest, best way, free way that you can help yourself. And when you eliminate, it is tough because there's so many things that are just everywhere, and you're very limited. But if you can get to a place where you're starting to add things back in, and then seeing what specifically actually triggers your symptoms, then
Yeah.
that's what you have to eliminate, and it's not always gluten.
Well, that's interesting because that's what we do with little kids when we start feeding babies for the first time. It's let's try this avocado. Okay, how does avocado make you feel? You
Yep.
have it for 3 days, and then it's like you go on and so on. And I think that's a really important thing to even think about because that's what we
I
should be
wouldn't
doing.
have thought of it that way, but it's exactly what you do with kids is you gradually introduce them to
Yeah.
stuff. And if there's ever any issue, you back off of it and then you try to distinguish. It's no different when we become adults. I don't know why. I almost feel dumb that you said it. It was so simple because
Did that for a
but that
reason.
was
Just kidding.
thank you.
Just kidding.
For each of you, kind of as we come to a close for our audience, what are like maybe 3 things each of you first maybe that you wish people knew about your practice or the kind of things in their area that they should look for if they're interested in starting their own version of like experiencing your practice?
Oh,
3 things. I guess just ask questions. See if your insurance covers it for one. I mean, a lot of people don't even have any idea that acupuncture is covered.
Mm.
So if you talk to your provider and your doctor, see if you need a referral or something like that. Like, it's a great option to utilize that many don't even think is accessible. But especially in California, like it's super accessible here, and it opens the doorway to a lot of possibilities for people that feel like they have no more possibilities or options. So,
Fantastic.
that's actually a good point because I do feel like a lot of people don't know
mhm.
that insurance can. I mean, for some, it depends on the insurance, obviously, that can cover it, and I think that's a big thing to let us all know that for sure.
Yeah.
Yeah, and even without, insurance, I feel personally that we offer like treatments that are affordable for most people.
Mhm.
I think, we spend so much money on like Starbucks or like our cell phones without blinking an eye,
Right.
Yeah, that's true.
But when it comes to like your health, you're like, ooh, $200. I don't know if I can do that to become more healthy.
That's a good point, actually. That's a really
It
good
is, and
point.
I'm with you because I'm like, my son and I were having this conversation about making some changes at the house. And I'm like, well, if you just don't go out to eat once and then you don't do the following things, you can free up the same amount of money. We just have to prioritize it, right? Like, and I
That's so
think we do
true.
a poor job generally, and I'll say this for myself at times, especially when you're younger. You feel pretty good, so you don't always prioritize your health in that category, right?
Yep.
Prioritize going out, you prioritize spending
Mhm.
time with people, you prioritize the comfort drink or whatever, where you should prioritize how do I stay healthy, stay balanced, stay whole in a lot of ways.
Yeah. Yeah. I think maybe a couple of other things to look for. Well, number one, you can look on the website for the California Acupuncture Board. The California Board of Equalization is what handles the licensure and regulations for all professional licenses in the state. So make sure that whoever it is you're going to has an active license in good standing. Uh, and I think maybe one other thing is maybe look for a place that it doesn't you don't have to, like, if you live out in Apple Valley, like, and if you liked what we're saying, like, you don't need to drive out here to see me. There are great acupuncturists everywhere. California, actually, I think it still holds true. It has like 50% of the population of acupuncturists in the whole United States
Oh wow.
What?
in
Mhm.
California.
Wow, that's amazing.
Yeah.
So they're everywhere, and there are great practitioners everywhere. So look for someone, close to you, because the most important thing is showing up, right?
Yeah.
And, if you can try to go to a specialist far away, but um, it's more important for regular maintenance, and sticking with the same provider who knows your history. Yeah, find someone
And remind us
in
how
your
we can
area.
find you guys.
We are just up the street from you. We're on Long Beach Boulevard and Wardlow.
And Simple Health
Simple
Simple
Health
in Long Beach.
in Long Beach in Bixby Knolls.
And what is the thing that you wish people came to you sooner for? That like if you could say, oh,
Oh, that's
you
good.
know,
Yeah.
maybe you've never given acupuncture a try yet, but this is something that I wish people came to me earlier on that I could have helped you with.
It's a good one.
Oh, that's yeah.
I think for most things, I wish that.
Oh yeah, like
I think if people had more of a mindset of like preventative health. Like you were saying, when you're young, you don't really feel anything, but we should be, looking towards the future and just trying to, again, optimize ourselves for our whole lives to like be our best self for the entire time. But, for whatever reason, we've kind of been like cornered into this mindset where you only like take care of it once something happens. But maybe something doesn't have to happen.
Yeah,
If taken, the right, if made the right choices are made, I guess.
well, I look at it. I mean, our bodies are kind of. This is a rudimentary explanation, but like, you take your car for
I
regular
knew you were gonna
service,
say that.
right? Like you take your car in before your
Mhm.
car has a problem,
Yeah.
Right.
right?
Yeah. Exactly.
You would never have your pet not go get an exam, and right, like
Mhm.
people take their pets frequently, right?
Yeah.
People go yearly, and then it's so funny because a lot of young people don't even get a yearly physical, let alone really.
They wait for the
Probably
light to come on.
They wait for the
Yeah,
light to. Well, actually, they wait for the
yeah.
light to come on, and
Yeah.
then they wait for the smoke to be coming
Yeah.
from the back, and for it to be shaking,
Yeah.
and you can't go anywhere.
Yeah.
And then they're like, "Oh,
Something's wrong.
maybe
Something
I have a
might be wrong with
problem."
me. Yeah.
And then they usually
Yeah.
go somewhere else, and then they probably come to you.
Yeah, we're often the last resort, but we shouldn't be.
I
And
agree.
I use that car analogy all the time.
Okay,
when I'm
good.
talking
I wasn't the only one.
So Michael.
I'm so thankful for both of you.
Thank you. Yeah.
Thank you for having
Yeah.
us.
I'll
Thanks
have
for
to
having
come
us.
and pick on you guys, and I think maybe that's also part of. I feel pretty good, but maybe I'm also getting warning signs that maybe I need to be paying attention to that you'll see that I didn't.
I need to do the same because I've never had acupuncture before, and it's been something that I've
I think
been
it's
interested
time.
in. Yeah, I think it's
Okay.
time too.
Sounds
Over to
fantastic.
thank you.
Yeah, I hope for our audience, thank you for being part of this journey, for sharing and for listening because, for people who have never experienced before, acupuncture is really a life-changing thing for so many people. And like you said, a lot of it's covered by insurance. A lot of it's available closer to you than you think. Instead of waiting for it as a last resort, hopefully also they saw two lovely, warm, welcoming people that they'll feel a little safer, a little more comfortable.
Thank you.
Yeah. Thanks.
Yeah, thanks for
Appreciate it.
coming and sharing this conversation with our audience. We really appreciate you,
Yes.
and
Thank
we
you.
look forward to sharing the next episode with everybody.
Yeah. Thanks, guys.
Bye.